Basic hygiene routines must be applied by all health and social care staff where health and social care is provided, irrespective of care provider and type of care, and whether or not the patient/care recipient is known to have an infection. Care providers must ensure that the staff have knowledge of and apply basic hygiene routines, and receive regular skills enhancement in infection prevention and control. The aim of basic hygiene routines is to prevent the transmission of infectious agents in health and social care services. They are the most basic measure to prevent the spread of infections and healthcare-associated infections. Basic hygiene routines include rules for hand hygiene, use of gloves and use of aprons and gowns, visor/face shield or surgical face mask in combination with protective eyewear, hair and beard. Hello, my name is Niklas Paul Carrasco-Parra, and I have been a specialist certified nurse assistant for 7 years. I studied anesthesia, surgery and intensive care after college graduation. I have decided to share my knowledge, but also other people's knowledge, such as nurses and doctors' knowledge, to bring clarity to students in the field of healthcare and medicine. Hand hygiene. Contact transmission by hand is the most common mode of transmission in health and social care. Hand disinfection, and sometimes hand washing is performed to remove infectious agents and thereby break the mode of transmission. Hand disinfection. Disinfect hands immediately before and after contact with a patient. After contact with a surface or object in the immediate environment of the patient. Before a clean or aseptic task. For example, before work where the level of cleanliness of products is to be maintained, catheterization, wound care, injection administration, and handling of medicines and food. Before and after using gloves. After tasks where hands have become contaminated or dirty. After hand washing. Hand disinfection steps. Cup your hand and fill it with hand disinfectant, 24 milliliters depending on the size of your hands. The amount of disinfectant should be large enough to cover the entire skin surface. Rub the disinfectant all over your hands. Start with the palms, the back of the hands, the fingertips, and around all the fingers and thumbs. Finish with the wrists. If necessary, disinfect the whole forearm. Continue rubbing as described in point 2 until the skin feels dry. Takes about 20-30 seconds. If you need to disinfect your whole forearms, increase the amount of hand disinfectant. Hand washing. Wash your hands with liquid soap and water before hand disinfection. If hands are visibly dirty or feel dirty if the patient has vomited or has diarrhea. If hands have become contaminated with body fluids. Hand washing steps. Wet your hands with running water. Apply liquid soap to your hands. Rub the soap into your hands until it lathers. Make sure that the soap covers all surfaces of your hands. Start by rubbing the palms, the back of the hands, the fingertips, and around all the fingers and thumbs. Finish with the wrists. If necessary, wash your forearms as well. Rinse off the soap with running water. Dry your hands with paper towels. Turn off the tap using a paper towel or your elbow. Disinfect your hands as described under the heading Hand Disinfection above. Gloves are for one-time use only and must be changed between each task and each patient. They are worn when in direct contact with body fluids or when there is a risk of exposure to body fluids such as saliva, blood, urine, feces, vomit, and other bodily secretions. Gloves are also worn when performing activities that result in the hands becoming dirty and when in contact with disinfectants. Do not reuse or disinfect gloves. Gloves are used to prevent the hands from becoming heavily contaminated with microorganisms. When gloves are used, it is sufficient to disinfect the hands after the task has been completed. Before each task, assess whether gloves are necessary for what you plan to do. Gloves become contaminated during use and spread infectious agents in the same way as a contaminated hand. Infectious agents can spread between patients and staff via contaminated work clothing. A disposable plastic apron or a gown must be worn when there is a risk of work clothing becoming contaminated through direct contact with the patient, body fluids, or other biological material, such as skin and skin scales. Disposable plastic aprons must be discarded immediately after use and between each patient. If a reusable gown is used, it should only be worn in relation to one patient. Change the reusable gown daily and when it is visibly soiled or damp. For wet tasks, use a disposable plastic apron. Local instructions will specify whether aprons or gowns with more extensive coverage need to be used for specific infections or situations. For tasks where there is a risk of body fluids splashing on the face, protective equipment such as a full face visor/face shield must be used. Alternatively, goggles can be used in combination with a fluid-repellent surgical face mask, type IIR. To reduce the risk of transmission of infections, spillages of body fluids must be decontaminated immediately with an alcohol-based surface disinfectant with a surfactant or a disinfectant with equivalent effect. Gloves must be worn when in contact with disinfectants. Thank you for watching this video made by Niklas Paul Carrasco-Para, Specialist CRNA on active duty of surgery in Stockholm, Sweden. If you want to contact me, you can do so by emailing me at niklaspolcarrascopara@gmail.com.